Experts estimate that 1 out of every $3 spent on healthcare in the United States is wasted. Per the 2019 report by the Commonwealth Fund issued in January 2020, the United States spends nearly twice as much per capita on healthcare as other high-income countries in the world, with healthcare spending representing 16.9% of our gross domestic product. These costs are forecasted to continue to grow at 6% per year for the foreseeable future, or at nearly 3 times the historic rate of inflation. Despite these significant outlays, the United States ranks dead last among the 11 developed economies on various measures of quality and outcomes. For example, the U.S. experienced poor performance in these key measures: lowest overall life expectancy at 78.6 years versus an OECD average of 80.7, highest rate of obesity at 40% of the population versus 21%, highest rate of suicide at 13.9 per 100,000 in population versus 11.5, highest level of chronic disease burden at 28% of the population versus 17.5, lowest rate of practicing physicians per 1,000 in population at 2.6 versus 3.5, significant overutilization for such treatments as MRI scans and hip replacements, high rates of preventable hospital admissions due to hypertension and diabetes, exceeded only by Germany, and highest rate of preventable death at 112 per 100,000 in population, which is about 50% higher than the average of 73.1. Contributing to the explosion in healthcare costs are high error rates in processing medical claims, as well as excessive variations in the costs of negotiated medical procedures, even within the same geographical area. Each year, the Centers for Medicare and Medicaid Services performs their comprehensive error rate testing across approximately 50,000 medical claims, covering inpatient, outpatient, physician billings, and durable medical equipment. Paid claims are audited by CMS to verify whether the recipient is eligible, the services were actually received, the treatment provided was an eligible service, and that the treatment was medically necessary. Additionally, claims are audited for conditions such as duplicate payments, incorrect amounts, improper medical coding, and adequate documentation. In addition to these errors, the most common source of waste we have seen for commercial healthcare claims are excessive charges. These are charges where the treatment cost incurred is often 3, 5, or even greater than 10 times a competitive market value for that treatment. Healthcare costs are a significant expenditure for self-insured organizations and, in fact, represent one of the largest budgeted costs. Additionally, self-insured organizations serve as the health plan sponsor, with their leadership team in human resources, total rewards, and benefits on point to exercise and fulfill the fiduciary role as a plan sponsor. Therefore, benefit leadership requires timely and detailed access to their healthcare data, claims, and all supporting documentation for those expenditures. Because of rapidly escalating medical and pharmaceutical costs, the high rate of billing errors, large variations in pricing for the same procedures in the same geographic area, and the overall lack of transparency over our data, we hereby execute the Self-Insured Employer Bill of Rights. Find that video on our YouTube channel alongside this one. We are FinHealth, and we help self-funded employers exert their rights to their own data. Visit our website at finhealth.com or email us at sales@finhealth.com for more information on how we can help you save millions of dollars a year on your healthcare spend.